Hey everybody, this is Kate.
And Devin.
Welcome to Med Crimes.
One of these times when we do our little video clips, we have to take a video of us dancing to our intro music.
It's so funny that you just said that because I just was thinking, like, why am I not taking a video of this right now? Because we've talked about that we vibe really hard during our own intro music.
Anybody else do that in your car when you're listening? Because I just we have our headphones on and no one else can hear it, but we're just like,
literally like vibing, living in the moment.
Here we are.
It is a special day. It's a really special day.
I don't know what you're talking about.
Happy birthday to Devin.
She's singing.
Happy birthday to Devin.
And now you're blushing.
It's Devin's birthday.
It's my birthday.
And she is blessing me with her presence on her birthday because she said, you know what I want to do on my birthday? I want a podcast. I want to do it. So
again, another reason why I recommend to all of you people to have your best friend's work schedule. Because it's like when we're trying to figure things out. Oh my God, you're not working today. Guess what I'm doing? I'm not going to work either.
Yes, she has a lot of information. She has a lot of information about me now, which is great. I actually do love it.
I do too. Yesterday, somebody asked me to switch weekends with them for our weekend manager schedule. And I was like, before I said yes, I was like, all right, I don't have anything on the home calendar. I don't have anything on the work calendar. Like, nothing right now at the moment was pressing me from saying yes to switching. And then I was like, let me check my best friend's schedule. Let me see if she's got a day off either before or after that so that we could podcast.
I love it.
Lo and behold, she did. So I said, sure. And then I already took Kate's day that day. I said,
love it so much.
You're mine.
So, happy birthday, Devin.
Thank you.
We are very, very excited.
Thank you. And this is the best birthday gift ever, to just be able to hang out. And some people are like, what are you doing tomorrow? What are you doing tomorrow? And some people are probably like, I mean, for me to just be able to spend the day with your best friend doing something fun and silly. What else could you ask for? Like,
you're making me tear up.
And it's also, oh my God, if we're going to get sappy. I mean, you're tearing up.
We could sap all day about each other.
This time last year, I remember being like, I miss my best friend. We're so busy. And I never knew when you were working, when you were off. And, we would always have these things. And now look at us.
I know.
Love you, champ.
I love you too, buddy.
All right. That's enough love. Conveniently, I'm wearing a heart on my shirt today, too.
Oh, that says love. I love that. Oh God, we got to put a picture up of that.
Love.
We love love.
Love.
Here at Med Crimes.
So much sap. Let's get into the grit.
You guys.
Dude, this has been our best week.
Oh my God.
Best week. I think we keep saying that every week, but.
We are so unbelievably blown away and touched by the response that we've gotten. And we have 4 new Patreons.
This has never happened to us.
I know.
This has never happened.
So this is so amazing. And
it's like, I feel like almost every day you were like, Devin, new Patreon. New Patreon. And I was like, what?
I was texting her every day, like, oh my God. And I told Devin about each and every one, about like who they are.
You all got individual attention of ours.
Yes. Oh my God. We care about you guys so much. All of you, every single one of you that are contributing. I mean, all of you that are listening, thank you so much for taking the time to listen. We really appreciate it. And our Patreons, though, are just like, I have that special spot in our house.
Of course. We got our own little group.
Yeah.
So, their names. Go ahead,
Devin.
Oh, okay.
You got this.
Monica Martelli.
Monica!
M&M. Are you the green or the red M&M?
Oh, she's the red M&M for sure.
Yeah.
Yeah. And then we have Avery.
Avery!
We got a couple of people that are Patreons doing the Madonna thing with no last name, which I totally love. It's great.
Rocket.
Avery.
Rocket.
Thank you, Avery.
The next one. Oboe.
Thank you, Oboe.
I used to sit next to someone in high school who played the oboe.
Devin played the clarinet.
I was the clarinet. We're part of the same family, Oboe. You and me.
And last but certainly not least, Caitlin Latchett. I'm so sorry if I'm not pronouncing that right. Latchett? I think it's Latchett.
I have no idea. I was
Well,
really
we
glad I
love
didn't
you,
have to say that
Caitlin.
one.
Whatever your last name is, we love you.
Thank you so much, Caitlin.
Monica, Avery, Obo, and Caitlin. You
Part
guys
2's for you guys.
are the peanut butter to our jelly.
Peanut butter jelly time.
Yeah, that. We love you guys so much. You are beautiful, majestic satyrs leaping through the forest.
Satyr.
Yeah. Satyrs. You know.
I'm not up in the whole fairy
You don't
thing.
know what a satyr is? Aren't they like a half goat, half man?
That's what I want to be as a goat man.
They're majestic and they play the piccolo. It's amazing.
Hey, cool.
Yes.
And we had our biggest play day this
Oh
week,
my
didn't
God,
we?
yes,
For
we
number
got-
of plays.
Yeah, Christopher Duntsch has gotten a lot of attention, and I think it's because the case is so modern, and also because there's, you know, like this new show that just came out of it that's really popular, and I think people are just like really interested. So we got a really amazing response.
Yeah.
And we've, you know, gotten a lot more listeners, so that's
and maybe
amazing.
my ego is saying that after we did our last story, that people, like, they're waiting for this next episode.
Devon's ego
Whether they
speaks
knew it was on
volumes.
Dr. Death or not, like, I
Yes.
gotta listen to their next episode.
Oh, yeah.
So it's not just all about Mr. Duntsch.
No, it's not.
That's my hope anyway. I mean, it could be delirious. I'm getting up there in age,
She's
so.
definitely delirious. She's gonna have some mild cognitive impairment happening here.
If anybody's out there that's, like, struggling through things and you're just like, ugh, I'm not riding through life. Your birthday's a good time to reflect on things, and let me tell you, my 20s dragged on
Oh my
and dragged
God.
on, and nothing, I mean, there was obviously good moments, but when I just think about my 20s, it's not something that I think about fondly.
Yeah.
30s flying by, man.
I cannot
Flying
believe how
by.
fast my 30s have gone.
And
It's
it's bliss.
incredible.
Dreams
Yeah.
come true in your 30s. I'm
Yeah,
convinced.
It's so true. It's
Yeah.
so true.
Dreams come
The
true in
30s
your
are the best
30s.
years. We're living in the good
Absolutely.
old days right now.
Yep.
So, without further ado, let's continue on with part 2 of Christopher Duntsch, Dr. Death.
Are you giving us just a brief, like,
I would love
60-second snippet?
I would love to.
And it's not like I'm going to count, like, and cut you off in 60 seconds.
Thank you.
You're welcome.
I was worried. So Dr. Duntsch is an American neurosurgeon who graduated from a top school, a top residency program, and a very competitive fellowship program. And he got a job at Baylor Plano Medical Center in Texas and proceeded to start to operate on people. And his specialty was spine surgeries.
Mm-hmm.
And unfortunately, his surgeries had overwhelmingly bad outcomes.
He wanted to be top dog without putting the work in.
Exactly. No matter what it took, no matter what field he was in, he wanted to be the top.
And we're starting to see
Yes.
what happens on the other side of not putting all this work in.
Exactly right.
And in part 1, we learned about his friend Jerry.
Oh, Jerry. So
That one
his
still
best
gets
friend,
me.
his lifelong best friend, who went under the knife with Duntsch for a fusion procedure and unfortunately did not fare well and ended up paralyzed, completely paralyzed. So very sad stuff. And then he had a girlfriend who things weren't working out with. They broke up because he had an affair with a coworker of his, Kim Morgan,
Mm-hmm.
who was a nurse practitioner on his staff. And she then broke it off with him because she started assisting in some of his procedures and seeing that his outcomes were so bad. And also seeing that he was sort of unstable and that he
He's
had
like,
had
"I want no
substance
part of
abuse
this shit."
issues. Exactly. And so she kind
Yeah.
of just distanced herself right there.
And so here we are.
And here we are. And Baylor,
He's resigned.
he's resigned from Baylor. He was allowed to resign from Baylor after sort of a legal back and forth. And as a result, he was not reported to the National Practitioner Data Bank,
Which is bullshit.
which is such bullshit. So essentially, they are allowing him to go off and practice somewhere else,
Knowing what he's like.
knowing what he's capable of. So from Baylor, he moves on to Dallas Medical Center, which is in Farmers Branch, Texas. And they granted him temporary privileges there. And this is important.
Okay.
Temporary privileges while they awaited his reference from Baylor. And so Baylor, as part of their agreement, issued him sort of a neutral or clean reference letter.
Right. Nothing
So they
scathing,
were
but
not
nothing exceptional.
Exactly. So Dallas was not given the impression whatsoever that anything bad happened at Baylor that should be of concern. So early on, behaviorally, there were a lot of red flags. So Dr. Duntsch really, wasn't having a great last year or so. You know, he had gotten this great job. He didn't do well. He was asked to resign, and he's sort of starting to spiral a little bit.
I'm not feeling bad for him.
No, oh God, no. Nobody should.
Remember how in other podcasts I've had times where it's like I feel bad for them before shit hits the fan?
Not this guy, though.
I have not yet at all. Not 1 ounce for him.
So staff noticed that he was altered a lot. Like he was under the influence of something. It was very obvious by his behavior.
Right off the bat.
Exactly. And
Okay.
he would show up wearing tattered clothing, tattered scrubs for days.
What?
And it was obvious that he wasn't bathing, he wasn't
let's
shaving.
try to not look professional at a new job.
And they noticed this because they would see, like, he's got, like, you know, a rip or some thread hanging from his scrubs. And a staff member that was working a stretch of days noticed, like, wow, those are the exact same scrubs he was in 3 days ago.
What the hell?
Like, what are you doing?
Mm-hmm.
And he's going into a clean operating, like an operating theater in this
sterile
outfit.
field. Those ain't sterile.
And he's not, and obviously his hygiene. I mean, he looked really disheveled. Like I said, he wasn't shaving. He obviously wasn't bathing.
Makes me question how well he was doing in that scrub room.
Exactly. So his surgeries at Dallas went badly, and we'll talk about those. So let's talk about Floella Brown.
Floella. I love that name.
Isn't that a pretty name? Floella Brown was to undergo a spinal fusion surgery with Duntsch. During the surgery, a lot of complications happened. The biggest one being that he completely severed her vertebral artery.
Oh, God.
So, of course, she had massive blood loss. And
Yeah,
again,
that's huge.
Again, Duntsch refused to even acknowledge the blood loss. And anesthesia was watching this go down, watching the vital signs deteriorate and going, dude, you've got this huge amount of blood loss here.
Pressure's dropping.
Heart rate's up. Like, do something about this. And he's not calling vascular. He's not calling trauma. He's not calling any of the appropriate specialties to come help with this. Now, he continued on with the surgery. He packed her full of something called hemostat, which is a hemostatic foam. It's a foam that we used in the OR if somebody has some capillary bleeding and it has hemostatic properties, and you just kind of put it in and pack it in spots, and it will help to congeal and form, you know, a barrier and help to stop bleeding. So he had, you know, severed an artery here, and he decides to just pack it full of hemostat.
That's out of the ordinary for that much blood loss.
I mean, this is never going to be enough to stop an arterial bleed. He had severed an artery, and he packed her field full of the hemostatic foam and just, like, crossed his fingers and hoped for the best. So he ended up using way too much of this foam, and unfortunately, Floella suffered a stroke as a result.
Yeah.
So sad.
Did she live?
She did live.
But obviously not the same. She had a severed artery and a massive stroke.
Mm-hmm. Yep. So, despite these complications, Duntsch, like, had a few days off, and she was having a really rough time. She spent some time in the ICU.
That was a tough
she was
surgery. I need a few days off.
Oh, you know, he just, like, took them off. And by a few days off, I mean, I think that what happened was he, like, left and didn't attend to his responsibilities and, like, went on a bender, which
so
may
this
or
is
may
like
not
the
be
second
true.
time, like, when shit goes wrong, I'm just gonna go in hiding.
Listen to this. So despite these complications, and despite him being technically on call, he did not respond to any messages for days from the hospital. For days. About her and other things, other patients. So Floella remained in critical condition. He not only refused to come to her bedside and attend to her because of her complications, he refused to transfer her to another facility.
Oh, come on.
Who would maybe be able to care for her. And his bright idea was to perform a craniotomy to relieve the pressure in her brain from the stroke.
What?
He wanted to do this. He said, "Oh, well, we'll
fucked
just
up
take
your
her
spine.
back."
Let's go into your brain next.
I know. This is just as this is insane. That, like, the thought process here, and the staff there was like, we don't do craniotomies here. We don't do that at this hospital. We don't have the capacity. We don't have the equipment. That's not a service that we provide. If you transfer her,
they can
do that. Somebody who does craniotomies.
Order, send to new hospital.
His specialty was minimally invasive spine, and
specialty is being a tool.
He was not even credentialed to perform a craniotomy.
Of course
as a neurosurgeon, that's not in his specialty. He did not complete a fellowship that included that in the brain. So after days...
Did he do it?
Days. No.
Thank God.
Days later, he finally concedes and elects to transfer her to a neighboring facility that had brain surgery capabilities.
Was it too little too late?
Devin, by this time, she was clinically brain dead.
Oh. Oh my God.
How upsetting is that?
What that... I know the nature of this podcast, so that means that there's more cases, shit goes on, but I want to be like, somebody, he's under a temporary privilege.
Yes.
He fucked up this one case
Yes.
right off the bat.
Yes.
So I would imagine that the hospital CEO, administrator guy, president dude is like, bye.
Yeah, so
Bye.
Duntsch
Please.
was a incredible talker.
Oh.
And very charismatic and was so good at covering his tracks that
How
if
can you
anybody
cover for that though?
if anybody comes at him, he would blame literally everybody else in the world.
Who do
and
you
say,
blame
oh, well,
for
it's
you not answering
anesthesia.
pages?
Anesthesia couldn't manage their blood pressure, and then all of a sudden, it's my problem. And the scrub nurse didn't know what they were doing, and the ICU staff doesn't know what they're doing.
I want to know what his excuse was for not answering those pages to care for her when shit started to go down.
Nah,
even
I don't
after
know
he
that.
already
I don't
fucked
know
her
that
up.
excuse.
How
I
did he
don't
talk
know.
his way out of that?
That's a great
I'm
question. I
sorry,
don't
but
know.
if you just blatantly disregard any of your on-call responsibilities and it's all on you and you ignore that,
That from me.
How
would
do
be
you talk
grounds
yourself
to
out of that?
Say goodbye.
unless you're in a hospital in a coma yourself.
Exactly. So, coupled with the fact that he's a great talker, remember, neurosurgeons bring in a shitload of revenue for hospitals. So these hospitals,
Yeah, well, I'm sure
are
in
hoping
lawsuits
and
they lost
praying-
a shit ton of revenue, too.
well, that's the thing. And I think they're hoping and praying that, this was an anomaly and they have no reason to believe that he's got like a history of this or a track record because they were not told.
Not at all.
Exactly. So, unfortunately, yeah, he was allowed to continue operating.
Oh.
So then we have Mary Efford, and she was scheduled for an elective surgical procedure to
no.
repair a chronic compression fracture and a herniated disc. There was a myriad of errors with this surgery. And this is a lot. So this surgery went really, really, really badly. He failed to remove the actual herniated portion of the disc that he was supposed to remove. Just, there's that.
Did he remove a different one again?
He applied hardware to the wrong level of her spine again. He's done this before. He left open screw holes in the opposite side of her vertebrae.
No.
It gets worse.
No, it doesn't.
Listen. He applied hardware to the muscle tissue rather than the bone.
Oh!
Literally screwing hardware into muscle. After it was applied,
No.
Devin.
No, he didn't. No, you're lying. You're lying. No.
Devin. After it was applied, it was so wiggly and loose that it moved when you touched it.
No shit.
Yes, it was
Can't
in
imagine.
soft tissue. It was in soft tissue. He screwed directly into and through a nerve root, a critical nerve root.
Okay, so I just have to say, I am not a surgeon. I will never be a surgeon. I have no desire to be a surgeon. You guys have such a specialized field and are crucial and critical to what you do. But I would know not to fuck that part up.
So let me tell you.
That's muscle, not bone. Let's not put a screw there.
These are the blatant errors he made, and I think this is why they were actually able to make a criminal case against him eventually, because
this is basic.
Any trained monkey would know that you're not screwing into bone.
This is not just negligence.
Like anybody.
Right.
I'm not a surgeon. I could probably go in there and tell the difference between muscle and bone.
Because obviously things happen in, when you're trying to have like medical lawsuits and stuff, right? Like things happen, doctors make mistakes and unfortunate things might happen, but none of it is ever usually on purpose. I'm not going to say none because here we are with this guy.
There's literally no way he did not realize how bad he was fucking this
there's
lady up.
malpractice and then there's criminal.
This is not malpractice. This is a literal trained monkey could have gone in and done a better job than this.
There's muscle. Don't put it here.
There's more. So he screwed directly through that nerve root. His surgical team was all watching him. Remember, these scrub techs, these circulating nurses, the anesthesiologists all watch these procedures day in and day out and could probably perform them themselves. They were watching this procedure in horror and knew that it was going outrageously wrong. He refused to stop. They literally told him, look, they pointed and said, you're screwing into muscle. This is not even bone. He completely ignored them. He did not stop. He just kept going.
I just don't
The staff were looking at him, and they recall that his pupils were dilated, and they felt like maybe he had to have been under the influence of something. There was just no way any human being would do that to another human being.
Now, you've been in an OR. You know.
Yes.
I'm assuming the surgeon is the lead.
Yeah.
The surgeon
That's their OR when they're in there.
Hard stop. I'm the CEO of this room.
Yes, 100%.
So is there nothing that they can do when they see this? When they see pupils dilated, they're under the assumption, like, there's nothing. They can't be like, call so-and-so. Like,
well,
like, how does...
No? I think that... I mean, I think that if there were ever a concern that a surgeon was altered, I would hope that the people in that room would take immediate action to protect the patient.
Call the head of neuro.
Like, call, you know, literally anyone.
Yeah.
Literally anyone. The department chair, the head of the, you know what I mean? Somebody. Call somebody. Chief of surgery, or somebody who is his supervisor to witness what's going on. I don't know that any of that happened here. I don't know, and I don't know what happened or why. But again, his confidence and the way he just flippantly blew everybody off and just blew up at people if they questioned him.
Please tell me, like, for the next story, people are starting to be like, yeah, I'm not working in that OR. My name's not going on that board with him.
Right.
Like.
So Mary woke up in 12 out of 10 excruciating pain in her legs. And
she's got a screw in her muscle.
She was left paralyzed from the waist down. And so Robert Henderson is a veteran spine surgeon, and he worked at Dallas Medical Center, and he was called to evaluate the patient and perform a salvage surgery on Mary. And
basically salvage what you can.
When he opened her up, he could utterly not believe what he saw. He actually knew. As soon as he opened her up, he said, there is going to be a massive lawsuit here, and I am going to record this surgery.
So that you could see every piece of what he's having to fix?
So that he could... There was a record of exactly everything
and
that
what
he encountered.
Did, a record of
which
what
was
Duntsch
super
did.
Smart on his part. So he actually compared what he found in Mary's back to the results of a child playing with an erector set.
Ugh.
There was absolutely no rhyme or reason. He wondered if he was an imposter. He wondered if this guy was even a surgeon.
This can't even be Mr. Christopher Duntsch with this resume. Like,
anybody
this is his
who's
twin
ever
brother.
even watched a spine surgery in the past would never do this and think it's okay. And anyone, I mean, with any real surgical training would never botch a surgery like this so badly. He could not comprehend this level of botchery. And he called Duntsch's performance an assault. He said this was an assault on this woman.
That's what it is.
This was not a surgery. This was an assault. And anyone with a basic knowledge of anatomy should know that they're operating in the wrong area of the back and that they're screwing into muscle and soft tissue and not bone.
And the difference between muscle and bone.
Yeah. So Dr. Henderson was so floored by all this, he starts really getting involved in Chris Duntsch's case and inserting himself into the situation. And he starts doing a little bit of checking up on this guy, like where did this guy go to school? What residency program did he attend? Like what's the lapse here? Because this guy cannot possibly be an actual physician. So he calls around to all of his past instructors and his references all by himself, and he confirmed that yes, he had attended medical school and residency and a fellowship program. And he called and spoke with his residency and fellowship supervisors, Dr. Foley. Remember Dr. Foley? Mm-hmm. And it was then he learned that, there was an incident that he had to go to that rehab program for impaired physicians. Mm-hmm. And also that the head of this rehab program, the head of this residency and fellowship program had financial investment in this company that Duntsch poured so much energy into
Dysgenics.
this Dysgenics company.
He should have just left and gone to research.
Exactly.
Like, honestly.
I'm telling you, if he had stayed in research, this guy would be on the top of the world.
If he stopped his surgical
residency
no
business
and went into
holding
research.
a knife. No business whatsoever.
Yeah, 1,000%.
Yep. So he started to wonder, like, was this guy, given breaks, let off? Like what was happening that he missed so much that this is the level that he's performing at this point? So these were the only 2 surgeries at Dallas, thankfully. They both went terribly wrong. And he was terminated immediately from Dallas Medical Center after only 1 week of working there.
So they terminated him, whereas at the other hospital he resigned.
Yes.
So please tell me that because he was terminated, they reported him.
Stay tuned. Despite both of these surgeries going outlandishly bad, he was once again never reported to the National Practitioner Data Bank because
why? Tell me
at
why.
The time,
what was their logical reason?
At the time, hospitals were not legally required to do so when a provider only has temporary privileges. Remember the temporary privileges.
That. You're not required. Do you want that guy going to the hospital down the street to do the same thing, and then they find out he worked for you?
Exactly.
You're not required.
Exactly.
But let's do a favor.
Exactly.
I do a lot of shit I'm not required to do. Anybody else?
Sometimes you just got to do the right thing, and not the thing that protects the hospital, but the right thing in general. Like it's ridiculous. So, shortly after leaving Dallas, he receives surgical privileges at
Where'd he go now?
Southampton Community Hospital in Dallas, as well as a second job at an outpatient clinic called Legacy Surgery Center. And this was located in the neighboring town of Frisco. While working in these 2 facilities, he continued his tirade. So, there were a few...
I'm about to go on a tirade.
Yeah, she's shuffling and... This is not.
I know. Remember last episode we had the lecture about me sitting on my hands and not fidgeting? Well, I'm so angry.
Yeah, I know. I gotta get the duct tape back
careful.
out. Yeah, I know, right? So, Jeff Cheney presents requiring a vertebral fusion of his neck, and Dr. Duntsch managed to damage his spinal cord during the procedure. And when he woke up, he had lost all sensation in the right side of his body. Philip Mayfield.
I had nothing to say. I just rolled my eyes because
yes.
I'm just like, of course he did.
I could hear it. We could all hear it in the mic in the podcast. You're rolling your eyes. Philip Mayfield underwent a similar procedure requiring some hardware applied to the vertebrae in his neck. Now, Duntsch drilled directly into his spinal cord. Directly into his spinal cord.
Because that's a good idea.
This left him partially paralyzed from the neck down.
Of course it
did. And he required months and months of physical... He wasn't quadriplegic. Apparently, the injury itself didn't render him completely paralyzed. It was only partial. But he required months of physical rehab and did eventually regain the ability to walk, but only short distances, and has to walk with a cane.
Again, a life-changing mistake.
And the right side of his body remained paralyzed. And he suffered chronic neuropathic pain as a result. In February 2021, Mayfield contracted COVID-19 and died, presumably because he was at a higher risk of complications due to his physical state.
Yeah.
Yeah. So now we move on to Marshall Muse, who presented requiring a surgical reconstruction for degenerative disc disease in his back.
Oh, so you would think that because he's got a company called Dysgenics... that he'd be good with something with a degenerative disc disease.
Yeah, so...
No, not so much?
Duntsch, no surprise,
I'm reading it all over your
this
face.
as well. Yeah. So he left surgical hardware just floating freely between muscle and bone in this guy's back.
Yeah, because it doesn't need to be screwed in anywhere.
No. So he woke up in considerable debilitating pain, of course, because he literally had hardware floating between muscle and bone
and nerves
in his back. So Duntsch told him that this was normal, and he prescribed him so much Percocet that the pharmacy was left questioning whether or not they should even fill the prescription.
Oh my gosh.
He was left in chronic pain. He ended up on long-term opioids. He spiraled into an addiction, which led him to losing his job and his family. And he could not function at all without pain medicine. And later on, he remembered back that the day before he was scheduled to have surgery, he had read an article about Kelly Martin, who was the one that died at Dallas Medical Center. And I'm sorry, not at Dallas. This was at Baylor, the one that died at Baylor Plano. He called Dr. Duntsch to ask about it prior to his surgery, and Duntsch cursed him out and hung up on him. And Marshall regrets moving forward with this surgery.
Well, I mean, that's kind of a sign if your surgeon is not willing to be upfront with you.
Yeah, exactly.
I mean, I would think if you have any question about anything, if you see, I mean, somebody might have something in their past that, like, they didn't look great upon in any circumstance, but if you can't be honest and upfront about it,
right,
there's a reason. You got something to hide.
Exactly. So Jacqueline Troy was a patient that required a cervical fusion procedure, and he did this surgery as he did a few other ones with an anterior approach, meaning that the patient's not flipped onto their belly and to have the incision in their back. They actually go in through the side of the neck. Which it does. I mean, even for, you know, an experience, I mean, it's a high risk procedure. You're going very, very deep through a lot of very critical structorostructures in the neck.
The jugular, for one.
Yeah, I mean, not only that, but the esophagus, the trachea, all of the nerves, all of the carotid artery, all of that is something you have to be able to navigate through. So it's a pretty technical procedure. For a skilled surgeon, it's a challenge, but Duntsch ended up doing a lot of damage.
No kidding.
He ended up cutting her vocal cords, and he damaged an artery as well as damaging her trachea. Jacqueline was left barely able to speak above a whisper, and she was in the ICU on a ventilator for weeks due to the damage in her trachea. And due to the damage in her throat, she was unable to swallow without aspirating, and she required permanent tube feeds.
Oh my gosh.
Isn't that heartbreaking?
Wow.
This guy, like, stop. Like, fucking stop. What are you doing? Mm-hmm. You've not had a good outcome.
Not one.
And stop doing what you're doing.
Yes. So when does this hospital be like, okay, so sir, we're going to have a talk?
Well, around this exact time.
At least the other hospital was just like, yeah, no, you're it's been a week and we don't really like what's happening. So
we can commend that. We can commend that.
But
around this time, Southampton Community Hospital was sold, and it was renamed University General Hospital, and he was retained as active staff during that transition.
Big mistake.
He applied for and obtained privileges at Methodist Hospital in Dallas around this time as well. And the hospital queried the database, but of course he was never placed on it, so they never found anything about him and said, sure, yeah, you can come do surgery here. It's fine. I think what happened was, like, these bad cases happened during a transitional period for the hospital.
So who was overlooking?
Right, exactly. So it just was not on the radar. This pattern was not established there because it wasn't on the radar. So Jeff Glidewell was maimed and, like, very severely and almost killed by Duntsch during a routine cervical fusion procedure. He mistook part of his neck muscle for a tumor and removed it completely.
Oh my God.
In doing this, he sliced an artery, causing massive bleeding, and he completely severed a vocal cord and punctured his esophagus. To staunch the bleeding, Duntsch used a surgical sponge, which is often used to apply pressure to bleeding and to stop it. And he stuffed that sponge into the surgical wound and sewed him back up. So, for those of you who have worked in an OR, you're screaming at me right now, sponge counts! Sponge counts are a holy and sacred thing in an OR. Every instrument, every needle, and, like, everything is accounted for before you sew up each layer of tissue.
Yeah.
So that we are not retaining anything.
So who did he blame on this one?
Oh, the OR staff.
Of course.
It was totally their fault. It was the sponge count. So what I think happened, though, is that he steamrolled them when they were like, hey, there's a sponge in there, and he just sewed them. He sewed them back up. Yeah. So this is how it's supposed to work normally. So the OR staff, not typically the surgeon, but the OR staff, part of their role is to make sure that every sponge, every suture, everything is very carefully accounted for, every instrument. And what happens is they count several times during the procedure the scrub tech along with the circulator, they do a count together to make sure that every single item that's supposed to be there is exactly where it belongs and not inside the body. And this is part of what we do to ensure that there are no retained objects inside the body, because it can, you know, things have historically been left in the body, and this is one of the things that we do to prevent that. So what happens is between every layer of closure, like say we're in an abdominal surgery and okay, we're done with the surgery, we're going to start sewing up the abdominal muscle back together. Now, as they're sewing, you're doing a count.
Okay.
To ensure that everything is accounted for. That
it's not in that layer.
It's not in that layer. Now it's time to sew up the fascia. You do another count to make sure that nothing's in that layer, and so on and so forth. And once the surgery is completely closed, you do a final count. You know, nine times out of 10, everything is accounted for, and that's it. And you know that you have a successful surgery and that we've left nothing inside the body. So if something is missing from the count at any point, everybody in the room puts their hands up, stops what they're doing, and nobody moves forward with the procedure until that item is identified. So if we say, whoa, we're missing a lap sponge, the surgeon respects that, because it would be on them if they left a sponge in the cavity.
Right.
They search for it. And I've seen it. It's very easy to happen. It's like abdominal surgery. There's a lot of gut in there. Somewhere. It's tucked, and they say, "Oh, okay, here you go," and they take it out. Sponge accounted for. Great, we can continue to sew. There have been things can fall on the floor and get kicked under the table. Sponges, they do that. They don't make a sound when they fall. They can go on the floor. So everybody searches the entire room until this item is accounted for. So the sponge count and the instrument count is a holy thing in the OR that everybody respects. So the fact that this guy completely disregarded that is just, it's assault. Right. Like Dr. Henderson said before, this is assault. So now that we're all fired up.
Beautiful, beautiful explanation of counting.
Thank you for thinking it was, thank you for thinking it was beautiful. I think you're beautiful. Happy birthday, by the way, again. So, poor Jeff Glidewell was left.
It's getting heavy.
With a sponge in the guy's neck. Staff pointed out to him that there was a sponge in his neck.
And he just sewed up around it. And
he sewed him up with the surgical sponge inside. And he was, of course, moved to the ICU because by the time Duntsch was done with him, he was in critical condition and on a ventilator. And they took radiographs, and the sponge was clearly visible inside his neck because these sponges have everything that goes in an OR have like a tiny little stripe on them. These sponges that's radiopaque.
So it'll pick up on a scan.
Exactly. So they did, and they saw the radiopaque stripe there. And when other doctors noted the retained sponge, Duntsch refused to help them remove it. And the retained sponge, of course, triggered a bad infection, and he became septic. After a few days, Dr. Kirby, remember Dr. Randall Kirby? We love him. He's a vascular surgeon.
Yes,
we worked with him at Baylor.
Who stopped him the very first time.
Yes. So, he also had privileges at Methodist, and so he would do surgeries at Methodist as well. So he and Duntsch, interacted again after the surgery.
He was thrilled.
He finally intervened and said, fine, if you're not going to remove it, I'm going to remove it because this person's going to die. When Dr. Kirby opened this guy up, he described what he found as the work of a crazed maniac. And it seemed to Kirby that he had actively tried to kill Jeff, because what other explanation would there be
to do what he did inside of his body?
Leave a surgical sponge and to puncture holes in the esophagus, in the artery, and it's just mind-boggling. There was no other explanation for such a botched surgery, and it was as if Duntsch had tried to decapitate him surgically.
Oh my gosh.
It was that brutal.
Wow.
So Glidewell did eventually recover, and by some miracle, but he suffered lifelong complications and has required over 50 subsequent surgeries to repair the damage. 50 surgeries.
50.
Isn't that
to
insane?
Fix all the mistakes from this one.
From a fusion. I just can't. So,
I see you still got more pages there. And
there's more pages.
I can't.
There's more pages.
I can't.
This did prove to be Duntsch's final surgery.
Thank the good Lord. I've been waiting for you to tell me that the end was near. That nobody was going to let him have another knife in his hand.
I'm not laughing at Duntsch or his victims. I am laughing at Devin's face.
I'm just like, finally, somebody stopped this dude. Privilege is stripped. You're not privileged any longer.
She's red, you guys. Her face is red. So...
Tell me more.
Okay. So, thankfully, this is Duntsch's final surgery, and University Hospital fires him.
Yeah.
So...
As they should. And reported him, please.
Dr. Kirby, the vascular surgeon that we like...
Was able to show them a pattern?
Right. So... He and Dr. Henderson start canoodling. Mm-hmm. So remember Dr. Henderson, who had done all that checking up on him because he had opened up a guy and done a revision surgery on one of Duntsch's patients and found the Tinker Toy mess.
And videotaped it.
And recorded the whole thing. You know what? I don't know if it was a videotape or if it was just audio recording.
Okay.
I don't know.
Regardless, he had
the foresight, though, to do that. It was very... So these two talked. And they were like, just appalled that this guy is still going around Texas operating on people and are going through all of his charts like, what the actual fuck is this guy doing? Mm-hmm. He's done this, 30 times to people. He's maiming people. We cannot continue to let him do this. And if the hospitals aren't going to take any action, we're going to have to get together and do something. So the two start working really closely together. So Dr. Kirby wrote this detailed complaint to the Texas Medical Board regarding Jeff's surgery and a whole bunch of other surgeries prior to that. And remember, he had worked with him at Baylor, so he knew a lot of the details at some of the Baylor cases, too. Uh-huh. And Dr. Henderson and him, were starting to kind of combine their knowledge of what he did. And now we're establishing this big pattern. So they're joining the fight. And then in the complaint field with the board, Kirby described Duntsch as either a sociopath or someone who was so completely incompetent. What he thinks, he said, I utterly believe this guy's a sociopath, essentially, and he's clearly a present danger to the citizens of Texas.
And here's the reason why I can back that up. Because I could imagine if you internally feel ill-prepared.
Yes.
Right. And you're like hopeful that, hey, I got my board certified. I'm going through this. Yep. I'm a surgeon. Crap, my first couple didn't go through. But I'm new. Let's get it together. But this is a pattern of maliciousness. Yeah. This is a pattern of incompetence. So this is purposeful. Mm-hmm. Because if anyone's good right mind, if they felt ill-prepared, whether they were certified to do it or not, if they felt ill-prepared, if they had a conscience,
right,
they would be like, no. No, I can't continue to do this to human people.
I'd like to think that if this were me, I would have the foresight to say, you know what? My outcomes are really shitty.
Yes.
I obviously need to do something and change my practice.
Yes, right.
And until that happens,
is why I'm backing you on the sociopathy.
Yeah, yes. Sociopathy. Yeah.
That's why I'm backing you on that theory, because I completely agree. Because the disregard for any human life, disregard for any positive outcome, despite all of these things that have happened.
Exactly.
The egotisticalness of him to not try to improve himself so that the next one didn't have the same negative outcome.
Exactly right. So these two started heavily lobbying for Duntsch to be investigated. So as a result, the Texas Medical Board tells them, okay, we're going to suspend Duntsch's medical license pending a formal investigation. Mm-hmm. So there was this lead investigator on the case. There was a lot of back and forth because she wanted Duntsch's license suspended during the entire 10-month probe, but the board declined to do that and said, we're not going to suspend his license during this entire investigation because the complications of neurosurgical and spine in particular are the specialty that's most prone to complications.
I get that.
So they were different. The board members were difficult to convince simply because his level of incompetence as a trained surgeon was utterly unbelievable.
They wanted to just make sure that to be able to, if I'm understanding this correctly, to be able to do a thorough investigation, it was going to take about 10 months.
Yep.
They wanted him to be suspended while they did that, but it's going to take a while to determine if this was malice or if this was malpractice.
Exactly.
Right?
So what they wanted to determine, too, is that, was this just, really bad luck on his part and having a lot of really bad outcomes because this specialty in particular is so prone to having complications? Mm-hmm. Or is there something else that that's going on? So there was a lot of back and forth about whether or not his license would remain suspended during this time. But again, Chris is an incredible talker. He's boastful. He's confident. Finally, a veteran neurosurgeon named Dr. Martin Lazar was called in to review the case with the Texas Medical Board. And
as an expert witness, basically, right?
So he immediately sees these huge faults with Duntsch's botched procedures. And specifically striking to him was the disregard for bleeding. And he was quoted as saying, "You can't not know that and be a neurosurgeon. You
or any surgeon, I'd imagine.
And a surgeon in general, but a neurosurgeon too. You just can't not realize that someone is bleeding or disregard it. You can't do that and be a surgeon." So on December 6, 2013, the Texas Medical Board revoked his license. Revoked!
Never again.
So the problem with this, though, is that even if a medical board in one state revokes your license, it does not prevent you from seeking a medical licensure in another state. So Duntsch, at this point, relocates to Denver, Colorado. And at this point, you know, he's on a clear downward spiral.
No kidding.
He declares bankruptcy, citing debts in over $1 million. And
well, he had that $500,000 in student debt. And he's getting fired from all
and
these
he's not
jobs.
really made a real consistent income in a while
because he can't stay somewhere
he can't keep
and
a job.
last.
So he had some legal issues there too. He was arrested for DUI shortly after he relocated. And he was caught shoplifting, like weird little offenses that are like obviously the sign of something bigger. Like the man is not in a good place, clearly. Kidding. So, March of 2014, the lawsuits begin to emerge. So, Mary Elfand, Kenneth Fennell, and Lee Passmore all filed separate suits against Baylor Plano Hospital, alleging that they allowed him to continue operating despite knowing that he was dangerous, and also alleging that Baylor made a profit of $65,000 off of each and every one of their surgeries that was performed. You know, they all were essentially injured, and a lot of them beyond repair. And this hospital, Baylor Plano, could have put a stop to the whole thing by reporting him to the National Data Bank.
Yeah, well, that's what I've been saying since the beginning.
Exactly.
Yeah. So
Henderson and Kirby knew that Duntsch was just going to go to Colorado and seek medical licensure, and they didn't stop. Their main concern was that he could go, even if this hit the media, he could go to a different country and get licensed as a physician. They knew he was a danger to the public, so what they did was precedent setting, and we're going to talk about that. But they went to the Dallas County DA office to pursue criminal charges. And this would be the only way to really prevent him from practicing again, right? Mm-hmm. So this is where things get a little muddy because, and why this case really sets this huge precedent, because really never before has a physician ever been charged with criminal activity based on a procedure that they perform, because there are laws that actually protect against that. There are Good Samaritan laws that say, I can't be prosecuted if I accidentally do harm when trying to do good for a patient.
That's more of like a malpractice lawsuit. Here's your insurance for those things, or we'll just revoke your license, but you don't go to jail. Like if it gets to that, if it gets that bad.
Exactly.
But yeah, to have someone who's actually like imprisoned.
Exactly. So this is like, at what point does negligence and malpractice become criminal intent?
Yeah, absolutely.
And murder, essentially. Mm-hmm. So what they needed to do was prove that his actions were willful and not just out of ignorance and incompetence. Okay. So for his personal life, like we knew that Kim and he had broken up a little while back, right? Kim, the nurse practitioner. And he was a little bit obsessive, and he would often send her like these rambly emails trying to explain himself. And his emails got really weird. Like really weird, really bizarre, really dark.
How so?
He referred to himself as a god that nobody understands, and that like I'm among these mere mortals that will never understand my genius.
Oh boy.
And that everyone is jealous, and I'm going to do whatever I need to do to get to the top. And that's important because we're going to come back to that. So an investigation into the possible criminality behind his actions, ensues. And they start scouring his personal life. And finally, they come across some of these emails. And this was sent back in December of 2011, so a couple years prior, when his career had literally just begun. And this is a direct quote from one of these emails that he sent to Kim. So it says, quote, "I am ready to leave the love, kindness, goodness, and patience that I mix with everything else that I am and become a cold-blooded killer," end quote.
What?
So that kind of sealed the deal. The prosecution made
because that shows intent.
A huge deal out of this because
what?
It tells us that there was something in him that's, obviously there's some intent here, and that he said literally, "I am going to become a cold-blooded killer." That's literally what he said. That kind of sealed the deal. So doctors, even under the worst of circumstances, almost never testify against each other. But in this case, Henderson, Kirby, and Lazar all reached out and insisted on testifying against him.
They're like the golden boys.
Yes, they are. They really all are. So due to this overwhelmingly scary pattern and immense harm that he had repetitively caused to his patients, the DA gave the green light to bring this case to the grand jury.
Awesome.
So finally, in July of 2015... 1.5 years after his Texas license was revoked, Duntsch was arrested and charged with 6 counts of aggravated assault with a deadly weapon, 5 counts of aggravated assault causing serious bodily injury, and 1 count of injury to an elderly person. Now, this last count is very important because this last charge was for maiming and paralyzing Mary Eford, right? Eford. And they prioritized this charge because it carried the highest sentence range. Oh. And they knew that if they went for murder, that would get too complicated. They probably wouldn't get a conviction.
Right.
But this one was the next best because it offered the longest sentence. And they knew that the most important thing was that this guy needed to be incarcerated. He needed to be in a place where he's not going to flee the country and do this to other people. Mm-hmm. So that's what they really prioritized. So even in initial interviews, he denied having done anything wrong, and that all of these claims were bullshit, and that everybody else was screwing up around him, and these hospitals were awful. And I mean, he just maintained that.
Isn't that first line of defense is to deflect?
Exactly. That's what he's doing. He's deflecting. So during his trial, the prosecution argues that Duntsch had to have known that he was likely to hurt others unless he changes his approach, which is he failed to do that. He didn't change anything. Mm-hmm. So this demonstrated that the maimings were intentional, and prosecutors also faulted his employers for not reporting him despite many opportunities and plenty of reasons to do so. Mm-hmm. So they argued that Duntsch was motivated to continue operating because of the lucrative salary of a neurosurgeon, and that would solve all of his mounting financial problems. Now, Duntsch's lawyers protested, blaming their client's actions on poor training and lack of oversight by the hospitals. But they did have that 2011 email sent after, those first few surgeries went wrong, which proved that
What are you going to blame that on?
Exactly. So, and they even cited back to Dr. Foley and that whole company that they both, were involved in, the Dysgenics, and how he was let out of his responsibilities of residency and fellowship routinely because of his responsibilities to the company. Exactly. So they cited that, this really truly was a multi-system failure. He was failed by his residency program and by the fellowship program and by, all of these hospitals. And there was just so many levels here of failure that it is just atrocious. Okay, so the director of neurosurgery at UT Southwestern, Carlos Bagley, testified for the defense, saying that the only way that this happens is if the entire system fails the patient, which that makes sense. That's not untrue. A lot of victims testified, and prosecution had to demonstrate the gravity and aftermath of, what happened with these patients, and that was really sort of the nail in his coffin. I think everyone obviously
coming up in wheelchairs that can't move their legs, some of them their arms.
So the trial,
the tube feeds,
exactly. The trial lasted 13 days, and after the trial, the jury was set to deliberate. And it only took 4 hours for them to reach a verdict.
Mm-hmm.
And the verdict, of course, was guilty on all counts. So on February 20th of 2017, he was sentenced to life in prison.
Yes.
In May of 2019, he filed an appeal, which was declined.
Good.
Bye.
Bye.
The 4 hospitals which employed Duntsch all have ongoing civil suits against them.
I'm sure, as they should.
Yes. He was imprisoned at the OB Ellis unit of Huntsville, Texas, and he will not be eligible for parole until 2045, when he will be 74 years old, and definitely not going to be able to operate at that point because there's no way he would get privileges to do so.
Yeah, I mean, you've been out of practice for however long. You're way too old.
Exactly.
Yeah.
And at that point, you have a bad criminal record for hurting people, so it's just not going to happen. So, this case marks the first time a physician has ever been convicted of criminal charges for actions that they take on a patient under their care.
Wow.
And prosecutors call this...
it's the first.
I
know it's rare. I'm just surprised it's the first.
Well, it's just because of how complicated it gets determining...
I get it.
And not saying that this hasn't happened before. It probably has. It's just that navigating the malpractice versus, criminal intent piece gets very, very confusing and very muddy.
Right.
So...
It's different in the other cases where, like, they were,
this
injecting drugs that they knew were
case.
wrong.
Exactly. Yeah. So this has been widely covered in pop culture, and I mentioned it in the first episode.
Hence why everybody was telling us to do it, and we're like, who's that?
Yeah, exactly. Because we're so disconnected.
We're winners.
So Wondery Media did a full 10-episode podcast on Duntsch exclusively, and it's called Dr. Death. I highly recommend it. Again, it's amazing. It includes interviews with patients and co-workers. It's super interesting. You get to all these little details that I didn't get to mention here. And then based on this podcast, they did this TV miniseries called Dr. Death, which I mentioned too. And that streams on Peacock. It's really awesome. It has Alec Baldwin as Robert Henderson, Joshua Jackson as Duntsch, and Christian Slater as Randall Kirby. It's really good. Following this, Dr. Death, the Undoctored Story, was released on Peacock, which is sort of like a sister like documentary that follows the Dr. Death stuff. And it's really cool because it includes the interviews with some of Duntsch's patients and colleagues, and super interesting. We're not, in a sponsorship relationship.
No, we're not.
We're just, I just love Peacock.
I got everything else.
Yeah. So that is the twisted, crazy story of Dr. Christopher Duntsch and his downfall. Thank God for the fact that he is in jail for a very long time, and he's never going to be able to hurt anybody again, hopefully. So, how you doing over there?
I'm staring at the twinkle lights.
She's staring at the twinkle lights.
I'm just like, how do I move on with the rest of my day? I mean, I move on with the rest of my day because he's in jail.
Yeah.
First of all. Yeah. He's in jail.
And
but it's
happy birthday to Devin. Christopher Duntsch is in jail.
No, but a gift.
Yeah.
Follow us on Instagram at MedCrimes Podcast.
Woohoo.
Send us a Twitter at MedCrimes PC.
Yes, ma'am.
Follow us on Facebook by searching MedCrimes Podcast. And if you wish to become a Patreon, visit www.patreon.com/MedCrimesPodcast.
Yes.
Thank you for listening.
We hope that you guys have a great rest of your day, and we really appreciate each and every one of you. And we really appreciate each and every one of our Patreons. You guys are just simply amazing.